Hey everyone, we are a few minutes early, so see who else shows up here. I forgot to put the registration on this one, so hopefully people got a reminder today. But we'll have a recording. I believe this is actually recording right now, so I hope everyone's doing well. And I will start out around 5 with a little meditation because I like to do that for these webinars. So hopefully this helps. Hey Bill, how you doing? Nice to see your face here. So you got the library in the background. I like paper books better than yeah, everything online at this point. So yeah, I hope everyone's doing well. This talk will be on hormones today. So any questions you have, but I'll do a little poll at the beginning because I think it's nice just to kind of have a discussion, be more participatory about it. Hormones are definitely there's a lot of confusion about hormones. It's always a lot to learn about hormones, so I feel like I'm learning something every day about hormones. So and of course, hormones are directing our existence in some ways, whether we know that or not. So a couple more minutes here. Yeah, and I think oh, great, we get some more people in here. I hope you're enjoying the spring weather. I know it's not spring yet, but yeah, it's great to see everyone. Welcome Adina here. Welcome Afren. Depik, welcome. Great to see you. Kathleen, welcome. And Michelle, great to see you too. Sorry if I'm not seeing everyone's names. I don't know everyone in here. There's some initials here, but great to see you. Hey Sue, welcome. Great to see you. But yeah, I will talk today about the adrenal health and adrenal hormones too. And now that the weather's nicer, one of the things that we can do to help our hormones is to get outside. So that's certainly one of the things. I hope you're enjoying this weather. Welcome, Elizabeth. Nice to see you. All right. So it's one more minute. I know I'll keep letting people in, but I'll start with a little bit of again. We know that meditation is actually a way to balance hormones. I actually going to talk about that a little bit. No, maybe I'll do that at first before we get into the main talk. Dr. Claudia is in the house, I see, I believe. Hey, Dr. Claudia, good to see you.
Hi, good to see
Also
you.
very experienced with hormone health, so I'd love to hear your thoughts today on this. We are recording this, by the way, just because I think I'm trying to do a better job this time. Trying to get back into Zoom here a little bit. Let's see. I'm just playing around with Zoom for a second, trying to figure out the best way to do this. Okay, I'll try this. I'll try this. You are the featured person on here, Claudia. You're the, that's what I see anyway. Is everyone seeing Dr. Claudia? I'm trying to figure
No,
out.
I see you.
Oh, okay,
I
okay.
see you,
I
doctor.
wasn't really sure because thank you. Appreciate the help with that. Um, yeah, so I'll do a little bit of a presentation, but I think also just a lot of Q&A and discussion and really participation. We can get started. I'll let people in as we keep going with this, but I'd like to start out. I know it's kind of, early evening here in the Washington, D.C. area. Hey, Anat, welcome. Great to see you on here. We're going to start with a meditation. We actually know that mindfulness and meditation and balancing the nervous system actually increases some of the key hormones, such as, we think of these as neurotransmitters, but they're also hormones. They actually have a lot of effect on our organ systems. So that would be things like serotonin and dopamine and epinephrine. So these are really, really important hormones and basically signaling molecules that can really be influenced by even 90 seconds of meditation. So that's what we're doing. If you'd like to put your hand in your heart and just kind of relax and try to settle in. I know you probably had a long day, a busy day, but just taking time now to center yourself, kind of be connected here to the CH community. I'm really grateful for all of you here today, showing up here and discussing, learning, but also discussing on hormones because I think this is a lot to learn for everyone together. So you can put your hand in your heart, and then, as I said before, we're going to actually start balancing our hormones now by putting our hand on our heart, taking a deep breath, and now I'll play the bowl a little bit. Deep breath in, Just letting your nervous system settle a little bit, feeling your feet on the ground, your hand, the warmth of your hand and your heart. And to exhale, just exhale at your own pace, maybe a little slower if you want to. A little bit of a slower, deep breath in and out. Just allowing yourself to settle, allowing a sense of safety into your nervous system, which is influencing your hormones quite a great deal. Just letting your body do the work, trusting it to make the hormones for you, trusting your body to make the hormones, but also deliver them to the right areas, wherever you need it, when you need it, how you need them, so that you can function optimally, optimize your wellness. A couple more deep breaths in and out here, balancing your hormones before we start our chatting and talking here. A lot of grateful gratitude for you. Inhale in, nourishing your adrenals here. Exhale out. Maybe even imagining your attention around your adrenals, which is in the flank area, right above your kidneys, if you know what that is. Just take a deep breath in and out, nourishing that kidney area. And then softening your belly as you inhale, just like do belly breathing here. Do one more inhale in. And exhale out. Thank you so much. I hope that was helpful to balance out your hormones. Irene, welcome. I see you on the screen here. Great to see you. Great to see everyone. And we are going to be talking about hormone balance today, but it's not about having a perfect level of hormones necessarily. It's about having hormone harmony, like how all the hormones play together, how they kind of co-create your health together. That's what the focus is today. Can everyone hear me okay? I'm just testing out Zoom again for the webinars here. So I think first I'll start with just a little bit of a survey really on hormone health. And we know that hormones are really important. I'll kind of discuss what that really means. But I'd kind of love to hear your thoughts on hormones. What is your actually what is your thought about hormones, your feeling about hormones, as we talk about hormone harmony, making the connections with your health here? Um, can you see the slides? I just want to make sure. Oh, did I? I didn't share my screen, did I? Sorry. I was like, I'm just looking at my screen. Okay. Okay, so all right, here's a little presentation on this, but essentially, how do we balance out hormones? How do we make the connection between hormone health and your overall health? That's the topic today. Thank you, Dr. Claudia, for coming in today. Dr. Claudia is expert also in women's health, hormone health, and gut health, and we can talk more about kind of some of the things that we'll talk about later this year. But first, I want to kind of ask everyone here, what's your feelings about hormones? Like, what are you working on in your own life? If you want to share that, I'm happy to. I guess your thought about what you want to hear today, because I have some things prepared, but I'd love to, I can also improvise. So let me know what specifically you want to talk about in terms of hormones, what your main health concerns are that you might want to, we can all discuss together today. Because it's really this is a service for all of you. So I appreciate you attending and listening to this. You're listening to the recording, but I'd love to hear some thoughts about, what hormone health really means to you. Okay, thanks, Elizabeth. So hormones that help you sleep better. Yeah, we can definitely get into that. Um, Definitely want to talk about that. That's great. I even have a slide on sleep, so that's good. Hormones that help you relax, reduce anxiety. I don't know about you, but I'm feeling a little bit anxious this year. It's kind of a weird time, I think, in our life here, but definitely want to work on that relaxation and anxiety connection between gut health and hormones. Thank you, Amanda. Thank you, Michelle. Aging gracefully, absolutely. Hormones are very anti-aging, so Hormones that give you energy. Yes. Oh, there's so much here. Thank you so much. You just like wrote my talk here. It's amazing. Um, Getting my thyroid. Thank you, TGE. Well, let's see. Thyroid hormones optimized so that other hormones can be better. Yes, yes, for sure. Increasing conversion from T4 to T3. What Irene is talking about is the conversion of the relatively inactive thyroid hormone of T4 into T3. We're definitely talking about that. Hormones to prevent afternoon loss of energy. Claudia, if you have any thoughts about all these, definitely feel free to chime in anytime here. Oh my gosh, that's amazing. This is like the quote of the year right here, Angela. I would like to know if hot flashes serve a biological purpose besides causing misery. Claudia, do you have any thoughts about that? I don't know. That's a good one. That's a good one. Yeah,
Yeah. Yeah.
yeah. You want to answer that now? I don't know the answer to that. Do you have an answer? Okay.
Yeah, so the question is if hot flashes serve a biological purpose before causing misery. Yeah, so hot flashes happen during perimenopause or menopause. I don't know if this is something some of you are experiencing now, but it's definitely related with a drop of estrogen, a drop of hormones that happen during menopause. Um, the biological purpose, I don't know if there is a biological purpose why estrogens will drop during menopause. But definitely, depending on your symptoms, there are a lot of things you can do naturally to improve low levels of hormones. So yeah, BHRT or hormone replacement therapy, it is an option, but there are other options like phytoestrogens that are a normal, like a natural form of estrogens that can help support your body that when it's low in estrogens. Mhm.
Yeah, I don't know. I guess I'll try to answer this too. Thank you, Claudia. I think this is just conjecture. I don't actually know if this is biologically proven theory. I think it's more of a theory, but how many people have grandkids? Does anyone have grandkids? Wait, is there any? I can't, let me see. Grandkids? How old are your grandkids? So I think the thing about like multi-generation is that, there could be some biological advantage to having multiple 3 and 6. Oh, very, very, very nice, very nice.
I don't know how you do any of that.
Having some biological advantage to having a multi-generational household where
Yeah.
you can help the survival and or thriving of the second generation offspring. That could be an option. That could be one reason why, people stop menstruating from that perspective. I mean, that's just an
Four,
idea. I don't know if there's any proof to that, to be honest, but
3 and 6.
look into that. We got some adult kids, Sheila. See that, Bill's got some adult grandkids. Is that grandkids? Okay. Yep, thank you. We will go to the next slide here. So I think, I'm a simple person. I don't know about you, but sometimes I think hormones are kind of confusing, kind of like this coloring book a little bit. It's a little pathway of hormones, We're gonna have a quiz at the end. I'm just kidding. So this is kind of from a coloring book, and I thought it was kind of funny. I just found this the other day. And then the other thing is I was at a functional medicine conference and they showed a picture of a pinball machine, and it's like this is kind of like what happens with hormones. You don't really know where it's going to go in your body. So we can talk about hormone metabolism today, but these are just kind of funny slides on how hormones can be complicated, but at the end of the day, it's also very simple in terms of they're really there to promote your health and help your health out in terms of the right amounts and stuff like that. So instead of hormone havoc or basically hormone chaos, which I know some people have this with symptoms and things like that, we actually want hormone harmony, like this conductor. I went to school in Boston, and I was privileged before he passed away to see this guy, C.J. Ozawa, who's the was the conductor of the BSO, the Boston Symphony Orchestra. So this is him when he had less, white hair and stuff like that. I'm starting to get some white hair, but that's how it is. But this guy is conducting, very masterly way and in a harmonious way, where all the kind of players, all the people, the musicians are playing together, and that's how you want your hormones to be. You want your hormones to be harmonious, playing together, not against each other, and you want to be able to understand like your body a little bit more to take charge of your own health, become the CEO of your own health. So that's why I brought this slide in. Before we get into hormones, I just want to give a little shout out to something we've been developing over the last year and a half. So I know we've moved locations, now we're in Potomac and all these changes, but this is a really exciting change that I want to just share with you. And you're all invited to this. We're opening a new movement and wellness space April 5th. For those of you that won't be able to make it because virtual, whatever, I'll make sure that we take some videos and all that stuff. And then whenever you do come, to come back to the office or whatnot, definitely invited to check it out. So I'm very excited about this because we also feel here at CIH that in terms of lifestyle medicine, movement is medicine, building muscle mass through personal training and fitness, and but also mind body practice like yoga, like meditation, sound healing will all be in here. You see some mirrors here, so we're actually going to have ballroom dancing here too. I don't know if anyone's interested in that. I'm going to try that out here. Hopefully I don't fall. Irene's into that. Thank you.
I did do it, yeah.
Yeah, yeah. And how did you like it?
Well, I actually competed 82 to 86. Like
Oh,
you see
wow.
Dancing with the Stars, I was like the amateur with the pro, and I went all the way to Virginia state championships. Yeah, I actually won
Congratulations.
in the theatrical.
Is it
Yeah.
isn't it it's like Latin or
Well, I did all of it, but I
all of
really
it?
like the Latin, and
Latin.
the
Yeah.
Cuban motion is a great exercise.
I know
That-
what I heard is we're gonna do is it bachata? Bachata, we're gonna do that and this opening here. It's a
Well,
good
I'd
replay.
start you out with rumba and then cha-cha, and then if you want to speed it up, go to mambo. Yeah.
Awesome. Awesome. Well,
Mhm.
hopefully you can check it out sometime you're here. It'll be nice to have a movement space. We're gonna kind of
Here's how
I
you
think
raise your,
really, really try to promote movement and exercise and fitness. And we know that's a big part of health. And that's actually a big part of helping out with raising hormone levels too. So that's another reason why I wanted to bring this up. So that's happening. You're all invited. We're going to send more, male chimps out, but love to see you there. All right. So what are hormones? We'll get into this here. Hormones are secreted by different glands. You've heard of, the insulin secreted by the pancreas, and the brain secretes different hormones, melatonin, and all this stuff. The gut secretes hormones to help you digest food. Of course, you have your sex hormones, testes or ovaries, etc., that are helping to secrete different sex hormones. But these are chemical messengers. They're just sending messages that basically direct your body to function optimally, right? So no message, no function really. So that's what I think about in terms of hormones. So they start out in the gland, they're secreted, but then they go to different places, right? Just like travel from the West Coast to the East Coast or vice versa, right? They're traveling somewhere, but then there's some result, there's some delivery of a message that basically influences your immune system, your gut health, your brain health, your muscle health, your levels of inflammation, and even certainly the expression of health and disease, both. So really trying to optimize
Hey,
by regulating hormones and making
what's
them
up?
harmoniously. If you
Interesting.
are, yeah, if you could mute yourself, I'm going to actually make Claudia, can I make you the host here?
Yes, sure.
Sorry, I just want to make sure. Just because I'm not good with these type of things. Make host or make co-host, make host. Thank you. Thank you. Okay. Anyway, so hormones, chemical messengers secreted by endocrine glands that travel throughout the body and regulate various body functions. Here's some examples of hormones we already talked about, but your adrenal glands right on top of your kidneys, they're going to secrete a stress hormone called cortisol. They can secrete DHEA and adrenaline. We'll talk about more of these in a minute. Thyroid, which I think someone mentioned before, your T4 and your T3. There's other hormones as well that your thyroid makes, but those are the main ones, T4 and T3. Thyroid hormone, you have reproductive system hormones like testosterone, estrogen, progesterone. Pituitary gland secretes many, many hormones, at least 10, at least or more, growth hormone and many others. And then your skin, liver, and kidney kind of all stack together to make active vitamin D. Pancreas makes insulin, glucagon. Your brain and your gut both make serotonin and dopamine. Parathyroid, which is up here near the thyroid, makes parathyroid hormone, which helps to regulate calcium. And then pineal gland helps you with sleep, onset with melatonin, and then you have thymus gland, which actually kind of involutes after the age of 40, and it doesn't produce as much of this, but it produces a hormone called thymosin, which is really important for the immune health, for immune health. So these are some examples of hormones. I'm not going to talk about all these today, but these are just examples of how many instruments there are in the hormone orchestra. Like those are all playing together, and we're still discovering pathways for how they all interact with each other as well as with overall health. I want to talk about adrenals first. I know we want to talk about hormone health and sleep. The adrenal glands really are affecting your entire body because adrenal glands are going to be heavily influenced by the autonomic nervous system in terms of the fight or flight response. If someone has trauma or chronic stress or just like always on the go kind of thing and doesn't have time to rest, like this person is resting in this picture, then the adrenals are going to be potentially taxed, and there's going to be an imbalance in the cortisol DHEA ratio. We know that cortisol is a stress hormone that helps with, as an anti-inflammatory, but also cortisol has some other effects that, besides reducing stress, cortisol is created in response to stress, but it has this idea of like trying to deal with stress. But then if cortisol gets too high and it stays high for too long, it can become low, and then that's also not good, and that can cause adrenal insufficiency. So you can have a cortisol issue with stress response being too high for too long, or you can have a stress response that's too low. So if someone has a low stress response, they might have low blood pressure. They're craving salt all the time. I don't know how many people do that. I like to crave salt too, but there may be some issues cardiovascularly. If someone has a high cortisol, that also can cause weight gain and insulin resistance and even higher blood sugars and things like that. So stress literally will increase blood sugar or cause blood sugar dysregulation. But in addition to that, it also ages you faster. Having too high of a cortisol ages you faster. It decreases bone density. It's associated with heart issues, associated with other issues downstream of the adrenals, like your thyroid and your sex hormones are also um, affected by adrenal dysfunction, essentially. But also, cortisol also suppresses another hormone that's made in the adrenals called DHEA. So if you think about, and I say this a lot in my visits, but thinking about cortisol and DHEA as two kids on a seesaw, if cortisol is too high, DHEA will become too low. And DHEA, you think about the 3 or 4 R's. So you think about restoration, repair, rejuvenation, relaxation. So really you have the DHEA as kind of a youth hormone or anti-aging hormone actually affects something called methylation. And methylation is really important in terms of having healthy DNA expression, having healthy aging. So the higher the higher your DHEA level, not DHA, which is like fish oil and omega-3s, but DHEA, the higher that is, typically, as long as it's not too high, the better for your overall longevity and wellness. So you want to have a balance. You don't want to have too little cortisol, but you don't have too much. So you have enough cortisol, if you look at my hands, enough cortisol, and then you have enough DHEA and everything's balanced. So that's one thing that is really, really important for whole body harmony. The other thing, and I think someone mentioned in terms of what are the hormones that are effective for sleep, if cortisol is too high, you won't be able to sleep because cortisol helps your adrenal cortex kick off adrenaline. So too high of a cortisol is going to kick off the adrenaline and you can't sleep. So cortisol will be high if you are working too much, if you're thinking about stuff, have racing thoughts, you're stressed out about the news, anything like physical to like chronic pain, reflux, like anything that causes some sort of physical stress, but also certainly psychological stress. If you can't shut off your mind and you can't relax, something that cortisol is going to be high, adrenaline will be high, and then you can't sleep. So important to balance that out. And there's a lot of ways you can do that. I think we can start with lifestyle. Certainly, we all kind of know these things, but having a regular bedtime, a regular time you're waking up, managing your circadian rhythm, getting outside in the morning, letting that sunlight hit your eyes, getting off the screens at night, eating 3 hours before bedtime, taking some melatonin if needed. That is something that I didn't put in the slides, but having enough melatonin that would help you with sleep onset. So when you think about hormones, to answer that question about sleep onset, you're really thinking about how is your melatonin level? Is it high enough to promote an antioxidant effect, to promote an anti-inflammatory effect, and to promote a sleep onset effect. And you need that melatonin to be a certain level. If you ever do a Dutch test, which is the functional test I'll talk about in a minute, you really want the melatonin levels to be 40, 50 or higher on the urine. Blood testing, there's not really a blood test for melatonin, so you'd have to do a functional test, or you can just take some melatonin and see if that helps you. Or you can do what I do at night, which is you wear these blue blocker glasses. They're amber or red colored glasses. That helps block the melatonin, and then you close your eyes, pull over the covers, and then sleep, and the melatonin goes up. So I think it's important to have enough melatonin. Besides that, in terms of sleep onset, you're really looking at two other factors in terms of hormones. One is going to be in terms of the basic things, which would be a GABA. So GABA is called GABA. That's a neurotransmitter called GABA aminobutyric acid, and basically that's really important for sleep maintenance. Sleep maintenance meaning you're waking up in the middle of the night. How can you maintain that sleep and go back to sleep? That's going to be GABA. People that take medications like Xanax or something like that, that has the GABA receptor, it relaxes you, makes you fall asleep, but those can be addictive and things. So you can take things like magnesium, lavender, lemon balm, L-theanine and stuff like that. You can even take GABA itself. So GABA is important for sleep. The other thing that's important for sleep is to lower that cortisol, which is just what we're talking about. So having the melatonin be higher, having the GABA be higher also because it's a relaxing neurotransmitter, than having the cortisol be lower. I think besides that, you also think about for sleep, sex hormones. Sometimes when the sex hormones are a little bit too low estrogen and stuff like that, you're going to have hot flashes. You won't be able to sleep because the hot flashes or night sweats, that could be important, and that can affect your adrenals. The other thing I'll mention, because it's important to talk about, and often this is really overlooked, if someone has high cortisol, is like super stressed out and they're tired, it might be that you have sleep apnea. If you have any sleeping issues, you're snoring, or if you just wake up after several hours and you're feeling like, okay, I should have enough rest, I should feel rested, but you're not rested, you might have sleep apnea. You have to be overweight to have sleep apnea. You can actually have a small airway, but a normal belly size, so to speak, normal belly size, not overweight, you can still have sleep apnea. So that's very, very common. And actually, it happens more as we get into menopause or andropause when hormone levels drop. Sometimes some of those tissues in the neck area start getting a little more saggy, and then that affects the airway that causes sleep apnea. So just because if you had the sleep apnea test a long time ago doesn't mean you don't have sleep apnea now. So that can be very, very important for your adrenals to look at. So, how do your adrenals affect your whole body harmony? In other words, how does your adrenal health affect your entire body? Having good adrenal glands and basically having healthy adrenal glands is going to help your gut health. It's going to help motility. It's going to help with your immune health. Having a balance between cortisol and DHA reduces inflammation, so that's good for the immune health because you won't have enough immune cells to fight off like too much inflammation or deal with too much inflammation. It's almost like having too many fires and not enough firefighters if the adrenals are not working, and then that helps, kind of cause more fires. So you actually want to have everything balanced so you have less inflammation. That's good for your immune system. And then certainly you have the adrenal brain connection, right? People that have high cortisol, they have lower hippocampal activity. What that means is that stress is bad for the brain, stress is bad for memory, and stress is certainly, as you probably all know, it increases the risk of dementia, which obviously is something we're all trying to avoid. So adrenals are really, really important in all the different organs. We also know that people that are type A, I think I said this last time, but people that are type A have an increased risk of heart disease. You know, I don't know if that's all genetic or something, but how many people know someone that got stressed out and then had a heart attack or had some heart issue? This is a very common thing. Or they lost their job and then, they have some heart issue. This is a very common thing. They've even done studies on people after they lose a Super Bowl, that like teams that lose a Super Bowl, that city, they have more heart attacks. That's adrenals. So, moral of the story, don't put all your eggs in one basket and root for one team only, ideally. Um, any questions about adrenals before I kind of move on to another topic? I might stop the share for a second. Let me see. Hopefully I can get back to it. Let's see. Claudia, can you maybe either answer some of those or read some of those?
Yes, I started answering some of them.
Yes, yes, yes. Oh, we can tag team, but I appreciate it.
Yeah, of course.
Uh, Sorry, I totally am still relearning Zoom here. Trying to
There's a
find my
question on postmenopausal belly fat. Is it related to too much adrenal cortisol?
yes. Actually, that's a great question. I'm glad you asked that question. Cortisol promotes weight gain. Cortisol increases insulin resistance. Insulin resistance means that not as much sugar, not as much glucose or blood sugar will be stored in your muscles and other organs, and basically it'll just sit out there and it won't be going to your cells. And then that sugar turns into fat, and then that fat turns into weight gain. So you definitely want to be able to balance your stress levels to promote weight loss if you're trying to lose weight, or in generally just have a
This
healthy
is
metabolism and
compounded
burn off
for
that
me.
energy. So the answer is yes, you definitely want to do that here. Okay, we still have some time to before we get to the next slide. Oh, thank you for answering these questions. Yes. Yes, yes, yes. Rao Optics, thank you. RA Optics, thank you, Irene. But postmenopausal belly fat will also be a result of too much adrenal cortisol, but also it could also be lower levels of estrogen and testosterone. A symptom that has accompanied my postmenopausal experience has been a prickling, stinging discomfort throughout the body. The accompanying result appears to be rapid skin age because collagen loss. Um, we can talk about bioidentical hormone replacement in a minute. That certainly would be helpful, and then protein, of course, to help with the collagen and things like that. How to measure cortisol? You can measure through a AM cortisol. I mean, the way to do it via insurance potentially is the LabCorp test. It's not really a great test, but if you wanted to do an AM cortisol test just to try that out first, LabCorp has a test called AM cortisol. You can ask your practitioner about it. AM cortisol is going to be best done fasting within 30 to 60 minutes of waking up. Otherwise, it's not that useful of a test. Otherwise, you can do the Dutch test, which I prefer, which would be and there's other tests, but that's called the Dutch test, DUTCH, stands for dried urine testing for comprehensive hormones. So we'll talk about that in a minute, but you can measure a 4-point cortisol throughout the day and night there, and that can be helpful. Box rescue remedy, yes. Thank you. Best not to graze, yes, probably not. Although hard to do sometimes, right? But yeah, you're right. I don't think the soy isoflavone metabolite is a problem. Not at that level. Not for vaginal. That's not really super systemic, but thank you. Okay, I'm gonna go to the next slide. I just want to make sure we got some. Sorry. We're going to affect the next two slides, which are thyroid and sex hormones, meaning if your adrenals aren't working right, then that will affect the thyroid downstream. Adrenals will also affect the sex hormones downstream. Think of it like a pyramid, with the base of the pyramid being the adrenals, the middle being the thyroid, and then top is sex hormones. You have to address all three levels of the pyramid, not just one, to have a stable structure. Thyroid hormone, the thyroid's shaped like a butterfly right up here in the neck. So that's kind of why that's there. And then I put a picture of a Porsche. This is not my car at all. So I drive a minivan. So, but anyway, taking my kids to soccer practice and stuff. So thyroid harmony also also leads to whole body harmony, right? Hormone harmony. That's the theme of this talk. Because your thyroid gland's up here. It's a really tiny gland up here shaped like a butterfly, but it affects all the organs. Every single cell in your body has thyroid receptors. That means all these hormones are not named correctly, right? It's not really a thyroid hormone. It's made by the thyroid, but it's actually a gut hormone, a brain hormone, an immune hormone, um, a muscle hormone, right? So actually, whoever named them, whichever endocrinologist named these way back when, is like they named it based on the gland they're coming from. But what we're trying to do today is where are the hormones going to, right? Because that's the most important thing. If you got a piece of mail from San Francisco or LA or Utah, that's great, but I don't really care. I really care about, did it go to the post office, and did it go to your mailbox? Does that make sense? You actually want to know where the hormone's going, not where it's coming from. I mean, you kind of want to know where it's coming from because you want to make sure that that organ's healthy, but it's really like, where's that receptor? Where's that mailbox, which is like all your cells. And that's really the key. So the reason why thyroid is important is because it affects your all your health. Like I said, we have people, and I think Claudia can speak more to this too. But people have brain fog, they have fatigue, they have energy issues. The brain is affected. Thyroid is really important for brain health. In fact, we know that unborn babies, or that they're in the womb, and everything. When they don't get enough thyroid hormone, then their IQ goes down, right? They have mental retardation. That's sort of the classic thing for low thyroid. But also, even as an adult, if you're not having enough thyroid, then you're gonna feel brain fog. You won't have as much, memory capacity. Your data storage is not as good, things like that. Won't function as well in terms of intellectual performance, but also thyroid's important for mood, for emotional regulation, is that we know that if someone has a low thyroid, that could be the cause, not just a side thing, but it could be the cause of depression. At the same time, if someone has anxiety or anger issues, it could be other things too, but could be personality. But a high thyroid, overactive thyroid, can actually lead to fits of rage and irritability and anger and things like that. So whenever someone has that, and if you know this person, hopefully it's not someone but if you do know a person like this that is emotionally dysregulated, think about their thyroid. Is their thyroid too low? Is their thyroid too high? Or is that just them? I don't know. But in any case, if thyroid is imbalanced, then mood will also be imbalanced. Brain will also be imbalanced. You also need thyroid hormone for a proper immune function. In other words, people that were in the ICU or in the hospital, they got COVID. If their thyroid function wasn't high enough, their T3, which is the one that we measure in functional naturopathic medicine, we measure free T3. When that was too low, people died more than if the free T was higher. So this is actually a life or death situation. This is not just like, let's make your thyroid a little bit better, feel better, more energy, although that's important too, but it's also immune health and survival, really. So free T3 is associated with longevity, higher levels associated with decreased hospitalizations, decreased ICU time, increased survival from COVID. So these are all really important, whether it's winter or spring now, or getting into spring. But just think about how all these things are connected. Your thyroid is connected to your immune system. Also, your thyroid's effect affects your energy. So thyroid is what we like to say is the rate limiting factor for energy. So this is why I have the car here. So imagine you have T4, which is usually what we're checking in conventional land. We're checking this T4 hormone. A T4 is a school bus. A school bus is basically taking you from A to B. It's metabolizing things. It's going to metabolize things very slowly. It's going to metabolize things with little fits and stops, just like if I'm trying to get to work and I'm behind a school bus or something, right? I'm going to get to work, but it's going to take me like 10 minutes longer because I'm behind a school bus, which is fine. It's good for us to be safe and not try to pass the school bus or something. But school buses, which we're going to call T4, right? That's a relatively inactive, slow form of thyroid hormone. It works, but it doesn't work that well. So what the body does is it takes your liver, your kidney, and your gut, and different organs, basically. In different organs, it turns the school bus into a Porsche. It turns the T4 into it turns the T4 into T3, which means that it turns a inactive thyroid hormone, i.e. the school bus, into a active T3 hormone. What that means is this hormone now becomes like Superman, Wonder Woman kind of person, right? That's like an amazing car, like Porsche or something, right? That what that means is that the metabolism goes up, your energy goes up. You actually need free T3 to power your mitochondria, which is the batteries inside your cell to make energy. So not enough T3 means not enough juice for your mitochondria, and then you won't have enough ATP or energy, and then you won't feel well. You'll feel fatigued. And that's why people that have a low free T3 are tired. So if you're tired, it could be because you didn't get enough sleep, your adrenals are off, you're stressed out, you're not getting enough oxygen, roll out sleep apnea. But now that you're learning, you can also be, what's your free T3 level? What's your thyroid function level? Not just the free T4, but what's your free T3? There's also, as we know, a conversion issue. Some people have trouble converting free T4 to free T3. In other words, they have a bunch of school buses, but not enough for turning into Porsches or other speedy cars that are going to help your energy, metabolism, brain function, immune health. And then gut health is another one. Claudia experienced expert in gut health here. We do know that gut health. I've actually seen this a lot with patients. I want to mention this is that I've had patients that have food sensitivities. They can't even tolerate foods. They have reflux. They have bloating. Once you give them thyroid hormone or improve their thyroid hormone, all the gut symptoms go away. So that's kind of an important thing. I kind of learned that by treating people. I didn't really know that. They didn't teach it at medical school at all. There's nothing about connections of, organ systems. It's all about like, okay, thyroid is endocrine, heart is cardiology, brain is neurology. But, when you actually get on to practice and you see these things, you practice functional medicine, you can understand that, because thyroid controls gut motility also, someone with thyroid is going to have that has a low thyroid, low free T3, they're going to have constipation, they're going to have gas, bloating. It's the most common factor in SIBO. How many people know about SIBO? It's called small intestinal bacterial overgrowth. Yeah. This is from the World Journal of Gastroenterology. This is research published stuff, is that the number one factor for someone to have SIBO is low thyroid. So if you have SIBO, think about low thyroid. Ask a practitioner about that. And then the second thing is that thyroid is going to affect secretion of stomach acid. That means if you have low thyroid, your digestion is going to be poor. You're not going to have enough stomach acid to make proteins, digest proteins, to amino acids, and then that's going to cause osteopenia and osteoporosis. So low thyroid will cause osteopenia, osteoporosis via gut malabsorption. So there's a big thyroid gut connection. And then we're going to get into vanity aspects now. Skin, hair, and nails. Dry skin, brittle skin, lateral eyebrow hair loss right here. If you look at this, hair loss, like in general. And then the nails get also a little brittle. That's going to be low thyroid also. So a lot of things can happen. Let's talk about how to optimize and harmonize the thyroid. So the first thing is going back to the adrenals, getting sleep, managing your cortisol, managing your DHEA, focusing on the lifestyle factors that really are fundamentally supporting your health. But then after that, it's like, what's causing all these thyroid issues? What's causing a low thyroid? It could be a lot of things like an autoimmune attack on the thyroid. Then you get into a bunch of things, infections, toxins, stress again, and gut health. So there's a lot of things that could cause thyroid issues. But you can also think about adrenal health, which you just talked about. And you can also think about different nutrient factors, especially if you're not getting enough protein, enough iodine, enough zinc. Those are really big factors. Selenium is another big factor. So you can check all these levels and you can see where you are. But you need different baking ingredients to basically make thyroid hormone, convert thyroid hormone from the school bus to the Porsche, and also to absorb thyroid into your cells. And that's the other thing is that we're going to go back to exercise now. When you think about exercise and why is it so important? This is not just about wellness only, although wellness is, I think, the most important, but it's about movement, it's about muscle building, and it's really about hormone production. Exercise is one of the best medicines, as you know, and exercise is going to help your thyroid function. In fact, one of my family members had like an autoimmune thyroid condition, basically. It was genetic in my family. And basically, she was told by her doctor, this was back in the 70s, but she was told, got to be on thyroid for the rest of your life. And that's okay. There's nothing wrong with being on thyroid because, it is bioidentical and it's good for you. If it's too low, you want to harmonize that. But she didn't listen to her doctor. Maybe that's why I'm a holistic doctor myself. But she was like, let me do some research and I'll get back to you, basically. How many people have done that? Like, taking charge of your own health, right? Let me get back to you. Let me do my own research and take charge of my own health. So she actually went out and figured out, let me eat more organic to have less toxins in the environment, in my thyroid environment. Let me take some vitamin D because we know that vitamin D is really helpful to get your thyroid hormone into your cell. You actually need vitamin D. If you don't have enough vitamin D, your numbers can be perfect, but you won't get the thyroid inside the cell. That's actually a really important point that I don't usually put on slides, but I think it's important just to say this verbally, is that you can test your labs all you want, and you can even test free T3, but sometimes it's not about the lab test. It's about, is that T3 getting inside the cell nucleus? Is it getting inside the cell? And you won't be able to tell that on a lab test. You can only tell that by how you're feeling and your response to thyroid medication or supplementation or vitamins or nutrition. But vitamin D is a way to get more thyroid hormone into your cell. So bottom line is my family member took vitamin D. She started exercising a lot more, which also gets thyroid hormone into the cell. And also she started doing organic food, back in the 70s. And then when she went back to her doctor and the doctor checked the lab test, he was like, hey, your thyroid looks really good. You don't need thyroid hormone, right? That was like 3 months. So it just showed me as a kid, I was like, oh, this is kind of cool. You know, there's must be something to this, right? Because I mean, something that she came up with. But the point of me saying that is that you can actually do a bunch of things, lifestyle, nutrition wise, that help your thyroid. In addition to medication, you might need medication, that's fine. But you can all do these things to help you synthesize thyroid hormone, to help you convert thyroid hormone, and to help you get thyroid hormone into the cell, which is where the true magic happens. Okay, so that's kind of thyroid. I know we went through that really quickly. Oh, the other thing is that if your iron is low, iron will affect thyroid too. You have low iron, you're going to have low thyroid usually. So all these different factors, you kind of have to say, which instrument is out of tune, right? That I'm a musician, so which instrument's out of tune? How do we promote and harmonize that hormone balance? And you have to figure out where that is essentially. But again, why thyroid is so important? I didn't mention this either. If you have a low thyroid, then you also automatically increase risk of death, sudden cardiac death, but more importantly, it's really cardiovascular disease, heart attacks, something like that, because thyroid increases high cholesterol. If you have low thyroid, that increases high cholesterol. In fact, when you look at your cholesterol pattern, and your practitioner can look at this with you, so I mean, I don't have examples that's on here, but we definitely see people where the metabolism of cholesterol is affected, and when you think about the metabolism of cholesterol, what that means is how much cholesterol is recycled back to the liver, and the speed of that recycling determines your cholesterol bloodstream amount. So if the metabolism is too slow of cholesterol, i.e., if you have low thyroid, that's going to raise cholesterol in your blood. And so usually what I say there is that if you have a recycling truck, I think a lot of you might live in Montgomery County, but let's say you live in Montgomery County and the recycling truck comes not once a week, but once every 2 weeks, what's going to happen to the trash and the recycling in your house is going to pile up. That's what happens with cholesterol. A lot of cholesterol is low thyroid. A lot of high cholesterol is low thyroid. It means that your thyroid's not processing the cholesterol, so that recycling truck doesn't come but every 2 weeks. The second week, the workers are just watching Netflix or something. They're not really doing their job. So then it's just sitting out there. And sometimes when you have the right kind of lab tests, you can look at that and you treat the thyroid, the cholesterol, we see that it goes down. So something to think about. Those are just thyroid, cholesterol, heart disease connection. Conversely, when you lower thyroid, I'm sorry, when you lower TSH, you increase T4, T3, basically, you're increasing T3 especially. That's going to help your cholesterol go down if that's an issue. Although I don't think cholesterol in and of itself is a bad thing, but if it's too high for some reason, you're trying to get it down, that's one way to do that. The other thing for the folks on there that might have kids or grandkids, or maybe you yourself, depending on your age, of trying to have kids, we've definitely seen that a lot. If you have low thyroid, it's going to be much harder to have a baby. It's going to be much easier to have infertility. And I know, Claudia, we've seen that here in our clinic where it's essentially like people are trying to have a baby. They go to a fertility clinic. They don't know what's going on. Once they put on thyroid hormone, then they have a baby and it's very healthy. They're a very healthy baby. So just some things to think about for thyroid. So again, thyroid is of receptors in all your cells. So it really should be called, all these things should be called whole body hormones. That's really a theme of our talk today is, these are hormones that are different organs, but what is the receptor organ? What is the receiving organ? And when you think about all these hormones affecting all these different, as we transition now into the sex hormones, which is another important slide, it's really about whole body hormones because all these hormones affect the whole body, and the receptors in every organ of all these hormones. I think that's probably the most important point of this. Okay, I'm going to stop the share for a second, try to get back to that. Got some chat on thyroid here. Thank you, Claudia. Oh yes, estrogen dominance. Very, very important. Did not talk about that either, but you can. I will say this. I guess I'll talk about that on the next slide. Yeah. Yes, yes, yes. Okay, thank you, Claudia. Okay, thank you for answering those questions. Okay, great. All right, let me try to go back to the presentation. Actually, I should probably leave it up because then I'm trying to find it again. Let me see. Okay, got it. All right, let me go back there. Hey, Linda, nice to see you here. See you on my screen here. Um, all right. Maybe this is what everyone's been waiting for. sex hormones, sex hormone harmony. First of all, I was saying this to a patient the other day. I don't think they should be called sex hormones. They're not just for reproduction. It makes you think like, ooh, sex, you know? But it's not. It's yes, libido and everything, but like I said before, it's really whole body. They're whole body hormones. Think of not where the hormones are coming from, think of where they're going to. So let's actually review how sex hormone health affects whole body health. So sex hormones, which, and for our discussion today, we're talking about testosterone, progesterone, estrogen, right? So there's receptors in the brain for all these sex hormones. So do we call them brain hormones? Maybe I would call them brain hormones. I love brain health, right? So testosterone affects memory and estrogen affects memory, certainly. Progesterone affects sleep. You know, one of the best treatments for sleep is compounded progesterone, for instance, or progesterone in general. So testosterone certainly affects brain function. And the other thing is we'll talk about heart health. Testosterone and estrogen both increase nitric oxide, which if you've spent any time with most of our practitioners, you'll understand that nitric oxide is really key to preventing heart disease and even to help arterial elasticity, which is like how yeah, elastic or you know um how movable, I guess, how soft and pliable your arteries are. So you basically don't want hard arteries, you want soft arteries. So relatively soft arteries. So nitric oxide helps keep your arteries nice and fluid, basically reducing the risk of plaque, reducing the risk of hypertension, and also increasing circulation too. So sex hormones, meaning estrogen, testosterone, are key for the production of nitric oxide. So you need sex hormones to make enough nitric oxide. And that could be one reason. I was thinking about like why this happens. We know that nitric oxide actually goes down over time as we get older, as we all get older. So after the age of 40, we have about 50% as much nitric oxide as age 20. And I'm kind of thinking, well, that kind of parallels the trajectory of the decline of hormones, right? So you think about, well, why is nitric oxide going down? Why is that? Well, it could be because, and this is just my theory because I haven't really need to research this more, but how you think about how you make those connections, testosterone and estrogen going down, the production of nitric oxide going down at the same time, there's probably a connection there. So that's why this is Dragon Boat Festival. I just kind of saw, so I took this picture, but the bottom line is you can actually see that you know, all the sex hormones are rowing in harmony with each other, right? Everything's kind of working together. So essentially what this means is that the sex hormones are affecting, we talked about brain, we talked about heart. Let's talk about bone health. I know everyone's concerned about bone health, bone loss, reducing the risk of osteopenia, osteoporosis, even reversing this. How many people know? I didn't know this before I started here and started working with amazing physical therapists, personal trainers. I didn't realize that osteoporosis, like coming out of medical school, I didn't realize this. I did not realize it was reversible. I just thought, well, I'm just going to put people on drugs, try to have them exercise, you know, try to have them take calcium and vitamin D, but it's not going to get better. But now I've seen people using these holistic protocols, and really a lot of people doing their own thing and us learning from them too. And then I'm trying to share it with everyone too, what they're doing. But you know, it's a combination usually in terms of bone health. This slide is not on there, so I wanted to mention this. When you're talking about bone health and you talk about hormones, there's three key things for bone health. One is gut function. You want to make sure that your gut is absorbing the nutrients that make the bone and make the muscle. So number one is gut. Number two is structural, which is having a stimulus to the bone, a positive stimulus, which is typically weight training, right? Some sort of body weights or lifting weights, that 3 times a week, ideally, if you can. And then the third thing is going to be hormone balance. And not everyone necessarily is a candidate to be on hormone replacement, but if you are, that certainly would be something. I've definitely seen many people now in our practice where they're having, you know, bioidentical hormone replacement, they're working on their gut function, their nutrition is really good, reducing gut inflammation, and then they're also doing strength training 3 days a week. And you see these people even without drugs, even without what is it? Anti-osteoporosis medications, thing like that. I mean, we'll give that to people too if needed, so that's fine. But you can definitely do it without drugs, and that's possible, or you can do it with drugs and even have better results. So I think ultimately, sex hormones, we're talking about brain health, we're talking about bone health, we're talking about heart health. And gut health is another one too. You know, it definitely can help with gut function. Remember that, and I think this is one of the most important points I want to make too, is that estrogen, progesterone, testosterone, they're not just hormones, they affect your entire body. They're anti-inflammatory. These hormones are anti-inflammatory. So we'll see people when the hormone levels drop, they start getting autoimmune disease or something, unfortunately. Their joints start hurting more, they get more fatigued. This is related to the immune system. There's more inflammation when hormones are low, so then you're going to have symptoms of a imbalanced immune system. But think about if the immune system is imbalanced, think about hormones. So think about that too. And then certainly muscle mass, same thing, need testosterone for muscle mass. And then we think about longevity. There's certain I think the most important ones would be DHEA, which is the adrenal hormone, and testosterone, and then estrogen as well are associated with longevity, especially estrogen. This is for men too. Remember that in men and women, it starts out with your testes or ovaries will secrete and then adrenals will secrete, testosterone, and beta testosterone turns into estrogen. Estrogen stimulates nitric oxide, but also estrogen actually stimulates telomere length. Telomere length. You heard of telomere length? Telomere length is basically the length of the telomeres, which is like how long you're going to live, basically, or that's prediction. So why is that? Because remember, we just said that estrogen, testosterone, and DHEA are anti-inflammatory hormones. They reduce inflammation. If there's less fire, there's less inflammation, there's less damage to your DNA. Less inflammation means less damage to the DNA. The telomeres last longer and you live longer. That's all about. So that I thought was really exciting. So think about again, start renaming sex hormones as whole body hormones that happen to be secreted by your, and of course there is a little minor detail of wouldn't all be here without people coming together and having sexual intercourse and reproducing. So I mean, of course, that's ultimately super important. Is that they are key for reproduction, and of course, there's infertility issues that you can talk to your doctors and practitioners about this, but you can see that they're more than just for reproduction; they're for your whole body. What else? I think that's it for that slide, and we could go into this. Okay, so we can talk about bioidentical hormone replacement a little bit. So, how many people either you don't have to answer this if you don't want to, but how many people are on bioidentical hormone replacement? How many people are, you know, not sure about it? What have you heard about it? I'm kind of curious about this. So there's hormone replacement, different types of hormone replacement. There's synthetic hormone replacement, which is more like birth control and synthetics, and we typically don't do that here usually. Sometimes I'll refill it for someone, but usually I'm trying to, if we do hormones, we'll do bioidentical hormones. So bioidentical hormones are going to be exactly what's in your own body, essentially. So that's going to be better if you think about it. You want to eat, just like if you eat food, you want to eat real food, not fake food. You want to take real hormones, not fake hormones. That kind of what that is. The problem with synthetic hormones is the following. They look very similar to real bioidentical hormones, but they don't look exactly the same. And your body's very smart. Your body knows if it's real or not. So I did some research for this presentation, and there's a couple things. We're going to talk about for women's health now, the Women's Health Initiative. That was a study done in 2002, 2002. Okay. The one on the slide is 2020. I'll tell you about that in a minute. So 2002, that's kind of what our dominant paradigm still is in the medical field, even like over 20 years later. But it's basically said that hormones cause cancer and, hormones cause heart disease and strokes and all this stuff. And you shouldn't take hormones unless you have vasomotor symptoms, which are hot flashes and night sweats. So fast forward 2019 to 2020, some of the original study authors that came on that original WHI did a reanalysis. This was 17 years later, in 2020, said, oh, we were kind of wrong about this. And estrogen actually decreases the risk of breast cancer, which is the opposite of what the conclusion was before, after, again, more analysis, more time, but that there was a potential for increased risk of breast cancer if someone took estrogen and synthetic progestin. Progestin is a synthetic progesterone. It's not bioidentical progesterone, it's synthetic progesterone. Some of you may know it's like norethindrone, and I think there's different ones, different other ones too. If anyone ever took the Depo-Provera shot, the intramuscular shot, as whenever we're doing that for birth control, like these things are synthetic progesterones. Synthetic progesterone is associated with an increased risk for breast cancer. That's why we typically use bioidentical progesterone. I found a study that was done in France. They compared a total of about 1,500 people, and they basically said that based on people that took bioidentical hormones like bioidentical estrogen, bioidentical progesterone versus those that took synthetic progestins, which is synthetic progesterone, the people that took bioidentical hormones, which is like estrogen, progesterone, that are bioidentical, did not have an increased risk of breast cancer in that analysis, whereas the people that took estrogen plus synthetic progestins, they did have an increased risk. So there is a difference, and this is shown and proven in studies. So if you want more information on it, some of the links are there. We do recommend if someone's on hormone replacement, pap smears, mammograms, like all the usual things. We do check blood work like estrogen, progesterone, testosterone, DHEA. We're going to look at that stuff, and we usually like to look at what's called dried urine testing for comprehensive hormones, which essentially is a metabolic test that looks at how your hormones are getting metabolized by the liver, how safe is it, and things like that. So we like to do that. It's not totally required, but we do recommend it. We know it's an out-of-pocket test, but safety is important. So I like that test. And I think hormones overall, I'm kind of coming to the conclusion after doing more research on this and having more training on this over the years that they are very safe, overall. And in fact, a lot of these original studies on, estrogen and stroke or, things like this, testosterone stroke, they've been completely debunked. And it's actually probably the synthetic progesterone that's the culprit. So that's my main takeaway there. GI map, if you're looking at the slide, is a GI microbial assay plus. That is a stool microbiome test that we do that also can tell you about how levels of inflammation in the gut might be affecting hormone metabolite pathways. So if you ever do a Dutch test and you're trying to figure out, well, why are my hormones all out of whack? Why are the pathways out of whack? The first thing you have to think about is gut health. What's your microbiome like? Because the microbiome is going to influence the hormone metabolite pathways, essentially. There's someone cleaning, so hopefully you don't hear that. I'm going to shut the door. Um, Okay. So we can talk about that. Those were my main three slides today. I just wanted to kind of talk about that. Oh, I think I have one on testosterone. I know it's 6 o'clock soon. Testosterone. So I looked this up the other day. So just to kind of get some more research on it. But testosterone is not associated with increases with heart attack and stroke. This is a very, again, debunked kind of 20 plus year old, kind of thing where, now it's like testosterone actually increases nitric oxide. Testosterone increases estrogen, which then increases nitric oxide, so actually decreased risk of cardiovascular disease. And that we do see that. Even I have a friend who hopefully he can come on one of these webinars one day, a great guy, Dr. Ben, but he talked about on one of our podcasts in the past where his wife actually had a heart attack at 35. Her testosterone level was undetectable. Once she got on testosterone, not only she feel better, but she's never had a heart attack again. She feels great. So it's not that it cures everything, but remember what we said before. Testosterone is anti-inflammatory. What's the cause of heart disease? Inflammation of the blood vessels. So low testosterone is going to be associated with higher cholesterol, higher cardiovascular mortality, and you kind of see that here. Whereas if you replace the testosterone, there was no increased risk of heart attack or stroke that you see there. We do recommend blood work, including prostate testing. There's really not a evidence at this point. This is also a debunked myth of like testosterone replacement causing prostate cancer. It may unmask prostate cancer that's already there because it changes to dihydrotestosterone, which can promote prostate growth, but it wouldn't cause cancer. So I think that's been well established down the literature. So if you're a guy, you're trying to figure out, should I increase my testosterone through TRT? But also for a female, you can also have testosterone too. If that level is low, that would help your health too. Again, doing a Dutch test and GI map. Again, just to kind of conclude this and hopefully have time for Q&A if you want to stay on. I appreciate your attention, participation here. Hormone levels affect your overall health, your health span, your longevity. We do a lot of bioidentical hormone replacement therapy here now, which probably we didn't do 10 years ago or 11 years ago when we first started. We're just trying to connect the dots, trying to help your people's, gut health, immune health, bone health, brain health. We realize like one of the missing pieces is hormones. So a lot, we got some extra training on it over the last year, working for you, working for your health. So we understand that hormone health affects overall health. And hopefully today there was some alignment of this, some harmonizing of this kind of topic for your greater understanding, greater empowerment. I want to thank you for coming today and listening to this and have some time for questions if you want to chat more about it. So thank you very much. Thank you, Claudia, for helping me host this too. Appreciate that. Okay. Let's see. Thank you, Michelle. Let's see. So I'm just trying to squeeze through the text here. Yeah, free T3, I agree with Claudia. Above 3. I think that, yeah, thanks for the comment on the E2, E3. I don't know that that's been clearly established in terms of the E3, E2. I think the progesterone is really more the key. But yeah, happy to chat with you about that more. So I used to think that HRT would be you have to wait and not do it if you were 10 years post-menopause, but I've seen people post-menopause, 10 plus years, still it being very helpful too.
Yeah,
Yeah,
I would say ideally best to start during
it is
perimenopause.
more ideal. Yes, yes, yes. But you can still get benefit even if you're 10 years post. Yeah. Is non-compounded? Yes. Non-compounded BHRT, knock on wood. We have seen that be covered by insurance. So if you do the bioidentical progesterone from the regular pharmacy, just make sure that you know it's made with peanut oil. So make sure you're not allergic to peanuts.
Mhm. Yeah.
We can do estrogen patch and progesterone pill, but we can also do creams and we do testosterone injections for men, and then we even do I just got trained over the last year, and I've been studying this for a while, but in the last year we've been doing some hormone pellets too. So that's been that's been helpful for people. We can talk about that more, and that can be helpful because you can have a more steady state if you're looking for more convenience, more steady state. That could be something. Yes, I believe I recorded this. Yes, I did. I did record this one. Yes. And I can stop the recording in a minute. I think I'll stop the recording now, but I want to thank everyone for being here. I can stay on and talk to you about insurance questions and stuff like that. I'm going to stop the recording.